Okay. Ayala Laub, how are you?
I am good, thank God. How are you? Thanks for having me.
Amen. Hodula Shem Kitov. My pleasure. This is part of a series that we're running, funded by the USY Alumni Network, and it's very nice. Um, and we're very happy to have you here. So let's get started. Ayala, first we're going to talk a little bit about you personally, okay?
Okay.
And then we'll get into the Shira Pransky Project itself. So where did you grow up?
I grew up in West Orange, New Jersey.
Okay, what exit is that for us non-New
Exit 7
Jersey?
off of 280.
Okay, got it. Good. And if you can describe your Jewish background, the type of household you grew up in, neighborhood, synagogue life, anything from that
Yeah,
angle?
I would say very typically modern Orthodox American. Like mixed community, slightly varying levels of religiosity, but overall
Right.
very modern Orthodox, very Zionist. I went to B'nai Kiva camps, things like that. Pretty modern Orthodox.
Okay, good.
Yeah.
And your family involvement, your parents, sisters, brothers, aunts, uncles, cousins?
Yeah. So my parents are heavily involved in the community I grew up in. This is being recorded. I know people are going to see this and he's going to be mad, but my father is the head of the Chaver Kadisha in West Orange. Any chesed thing you can think of, he is in charge of, even though it always says anonymous. So, so that's my father. My mother also always very involved in community life, any women's programs, things like that. And I grew up next door to my aunt and uncle and cousins. And my uncle was the youth director of our shul for a number of years. So, a little bit of a family business there in shul.
Great.
And yeah, it was great.
I asked specifically because I knew that your father had been active, and so it was. I want, and your mother also, and then here I didn't know about the next door neighbors. So that's amazing. What are your personal earliest memories? I won't say memory because that's always hard to pinpoint one, but your earliest memories of, let's say, tzedakah, chesed, giving, volunteering.
So my earliest memory of chesed and tzedakah in some way is pre-West Orange days. That's how early it is. We were living in Forest Hills. We lived there until I was 4. And my father was
that's in New York, for those who don't know.
Yeah, that's in New York, in Queens. And my father was a volunteer on Hatzalah. And so my earliest memories of chesed, where it's the two memories, they kind of go together. The first is that already by 3 years old, I knew that if I showed up to shul and my father wasn't there, which of his friends to go to, because it meant he was on a Hatzalah call. And also as a very little girl, kind of looking at my mother confused and being like, why is Abba getting in the car on Shabbos? That doesn't make sense. And having to get a whole explanation about saving a life. So that's definitely my earliest memory of chesed. And we've actually come full circle with that because my father actually just helped open the chapter of Hatzalah in West Orange and Livingston that he's been trying to do for years. So now they have Hatzalah there and we'll all come full circle.
Wow, amazing. Wow, very nice. High school, college, what are your experiences? Youth group, Jewish youth group, synagogue, traveling?
Yeah, high school, I went to Mayanot Yeshiva High School for Women.
Which is where?
Which is in Teaneck, New Jersey. It's a very modern, Orthodox, pretty feminist high school, girls learning Gemara 8 periods a week type place. Really.
Torah Mondays and Thursdays?
No, every day, but nothing special on Mondays and Thursdays. Yeah, it was great. I just have really fond memories from there. Place really focused on empowerment, on women being a part of the community and being part of Jewish life. A very inspiring place. And then growing up, I went to Moshav Ayo, Indian Orchard. Very standard modern Orthodox life here. Just went to my B'nai Kiva summer camps. Was there for a few summers, worked there a couple of summers. in general, yeah, my Jewish life was always very centered around those types of communities, that type of learning, that type of culture. And then after I came to Israel, I stayed and for college went to Bar Ilan University.
So when did you come to Israel?
I came to Israel 10 years ago.
10 years ago. So when you were like 9 or 10.
No, I was a little older than 9 or 10, not much, but a little older than 9 or 10. Oh, you mean when I came to Israel for life or when I came to Israel for the first time?
For life. No, for life, for life.
No, for life I came, I learned in Shalvim for women. And
but it was a post-high school program.
Yeah, it was a post-high school seminary where you just sit and learn Torah all day. And about 2 months into the year, I went to the head of the school and I told her I was dropping out because I was going to join the army. And she said, "No, you're not." And I said, "Yes, I am. How could I be here and not contribute?" And she said, "Come back to me in January." So I came back to her in January. I said, "Fine, I'll stay the rest of the year. But after I'm staying and I'm doing Shrut Leumi, it's not fair that other people, that we come here and we benefit from all the great things and we don't do anything. So I'm going to do Shrut Leumi." So after that year I stayed, I did Shrut Leumi. I worked in a program called Vadarta, which is like Vadarta Pnei Zakein, which is that you're supposed to, be respectful and kind for the elderly. And I worked, I did rounds basically between individual houses and nursing homes, and ran programs with them and did things like that. And then after that year, I officially declared Aliyah, and because I had to wait the year to give my parents time to absorb. And then I officially declared Aliyah, and then I went straight to Bar Ilan.
Great. And what did you do at Bar Ilan?
I studied Jewish history and history.
Great.
Yes.
Okay. At some point, you got married.
I did at some point get married. I met my husband the end of my first semester of college. Yeah. Then my attendance rate went down slightly. But it was fine. I did fine. I got my diploma. So
good. Okay.
And yeah, that's where we are.
Great. And you live now where?
I live in Efrat, in the Dagan.
Efrat. In Dagan. Gush Etzion is good enough.
Yeah. Etzion, Efrat, the Dagan. Should I tell you what street I live on? You want my address?
No, it's okay. No, we'll find it if we need you.
Okay, fine.
And how did you get involved in doing mitzvah work if you were a Jewish history kind of major and not a social worker or leaning to the humanities and that side of the field?
Yeah, so that's a really good question. I've always been involved in things related to social work. Even in high school, like I was a mitzvah clown, all of those types of things. And most people—
Where? Wait, tell us a little bit about that. 1 minute.
Oh, the mitzvah clowning.
Sure.
I did it in middle school and high school with my father. We did it mostly locally in Kessler Rehabilitation Center in West Orange, Daughters of Israel in West Orange, St. Barnabas Hospital in the Livingston area. We did it for a while on occasion, just walked around in clown outfits and tried to make people happy. And
what was your clown name?
What was my clown name? I actually don't remember. I know that I really don't remember. I think my father was Mr. Litzanas or whatever, because he was trying to do a play on words of Litzan and that he's an Atzlan, something like that. I don't know. So I did that. I've always been involved in social work in some capacity, and pretty much if you would have asked any of my teachers or school therapists or anything like that, everyone would have just assumed I would have done a degree in social work. And I did not do a degree in social work because after my year in Shrut Leumi was incredible, but it was an emotionally very difficult year. It wasn't physically draining. I wasn't doing physically hard work, but to sit with people who were well into their 80s and didn't have children and were really lonely and sad in a way that was very intense for, at the time, a 19-year-old. I was basically a social worker for lonely 80-year-olds at 19 with very little training. We had a 3-day seminar at the beginning, in fairness. So that was my training. And kind of after that year, I got really scared of doing a degree in social work. I was like, I don't know if I can handle it, because it would like sit on me. I would get home and I would feel the weight of these people suffering, and it really affected me. So I was like, okay, well, I also love history and I also love Jewish studies, and I also don't totally really know what I'm doing in my life. So I'll just get a humanities degree and see what happens. But then every single job I had was in some way in the informal education that ended up being social work type world. And I would basically, any job I had, when I would interview, they would call me in and they would say, yeah, we read your resume, it looks great. But then when we got to the bottom for education, we were shocked to see you didn't have a degree in social work. I was like, yes, because all I do is social work. So I kind of just fell into it because clearly that's what I'm supposed to be doing. And
great.
Yeah, it's
so,
perfect.
And what led you to the Shira Pransky Project, which you'll tell us about in a minute. But first, how did you get into that?
Yeah, so it's like actually funny how I ended up there. I was actually calling them in general because my previous job before the Shira Pransky Project, I worked as a chesed coordinator for one of these Israel programs, and I would try to set the girls up with different places, and kind of just came about them
for volunteer work.
Yeah, for volunteer work, exactly. And I saw that a lot of them were interested in working with the elderly, and I had not really heard of the Shira Pransky Project, but heard some of what they do, and I knew that they had a very big elderly population that would come to them. So I reached out to them to see if maybe they knew some people that they connect me with, and I could possibly set those people up, with companions. And then when I was speaking to them, it kind of came up that there was a job available, and I applied. It sounded interesting. I'm not a medical professional, but when I came to Israel and my eyes were opened a little to socialized medicine, that also is something that really, that was a major impact in my life. Having this realization that having healthcare is not the norm where I came from. And even though I had grown up in a community that was affluent enough that everyone basically had healthcare, that a lot of people didn't. And it was like I came to Israel and I needed something. It was my first time dealing with that as an adult. And I was like, I had that momentary thing of like, oh, who's paying for this? And then it was like, oh, it's taken care of. And then the realization that there were a lot of people in my position where I came from that didn't have that luxury. So healthcare was always something that interests me. And in general, the job is pretty closely related to program coordination, social work, all this stuff I'd always done. So I applied and I got it. And then just,
So how long have you been in total? How long ago was that?
That was almost 4 years ago.
And now you're the director of the project?
And now I'm the director, yeah.
So now tell us, what is the Shira Pransky Project?
Yeah, so the Shira Pransky Project, we educate and assist immigrants to understand their healthcare rights and access their benefits. That's fancy language for basically healthcare is really hard here and confusing. And we have a lot of amazing rights, but if you don't know what to do, you're going to be really stuck and miss out on a lot of things. So you can contact us and we help you. We offer workshops, we offer personal assistance. We have hundreds and hundreds of resources, and that's what we do. Yeah.
So even though the healthcare is free, you still have to know about it.
Yeah, it's the healthcare system here, I always say, is really, it's actually unparalleled in the Western world, the amount of benefits we get for the amount we pay, and the level of benefits we get. Even if you look at other countries that have socialized medicine, it's generally not as extensive as what we're offered here for the amount that it actually costs us. The problem is that everything in Israel is a bureaucratic challenge, including the things that you're entitled to. And also, in general, the culture here is just, if you have an in, if you know someone, if you know about something, then you can easily get it. And if you're an immigrant, you definitely lack that. And then it just becomes kind of a shame that people end up really struggling. We find that immigrants take a lot longer to get appointments. We find that they're much more frequently paying out of pocket for things that they shouldn't have to pay for. And we want to change that and make that better.
Arnie, can I ask a question? Arnie, can I ask questions?
I know you have to go. Yes, go ahead, Jonathan.
Yes, Ayala. My name is Jonathan. First, it's a wonderful story that you tell, and it's a real, tribute to your parents. Kol hakavod. Have two things. First, how have your parents adjusted to your aliyah? It's one thing to speak about aliyah and chutz la'aretz. The second thing, when their children do it, has that been an issue?
So my father was very, very supportive of my aliyah. He kind of a little bit regrets not doing the army himself. So he was very happy to send me along. My mother had a bit of a harder time with it, which I think is normal, but also very supportive. They both believe in the idea of living here. So they're very proud of what I am doing and how I'm living. Since I've effectively stolen their grandchildren, it's become a little harder for them. But they're managing, and actually, thank God, they are shifting a little bit their mindset, and their long-term plan is to hopefully end up here and be here at least most of the year. I think we're on now 7 years. I don't know, it's been 7 years for the last 3 years, who knows? But at some point, eventually, hopefully they'll be here, and they're very supportive of me.
Okay, so low pashut for parents. We met Aliyah, and then our parents followed us, so we were very fortunate. But it's a real seaport. In what languages do you offer your counseling services?
So currently, it's just in English. That's to specifically help the Anglo population. Also, that English is an international language. So if you're going to start somewhere, so English, yeah.
You wouldn't be opposed to having
the masses of people. The most spoken language after Hebrew is Russian. Do you have any Russian speakers, or are there, which really reaches into the guts of the Ole population? English is great, but it's a
good question. So there are a couple of answers to that. The first thing is that I'm not opposed to having other languages. It's just where we are right now, where we're limited in that way, and we don't have other languages. The other thing to note about the Russian immigrants in particular is that they actually do have a lot of, let's say, services that they got from the government, that when they came here, there are also many, many, many Russian-speaking physicians, and that's something that's a little bit lacking in the English-speaking community. So a lot of times there's a misconception amongst Anglos that kind of everyone speaks English and we're all wealthy, so we don't need help. And because of that, we have little to no funding or assistance from the government after Aliyah, versus these other populations like Russians, Ethiopians, all of those groups do get some support from the government. So we're kind of filling that gap a little.
Ayala, do you guys work with Birthright or AACI or any of those other organizations to promote your services to the new Anglo immigrants that are coming in?
Yeah, so AACI definitely knows about us. They send people to us still, and they definitely know about us. Birthright, a little bit less, because we're focused more on people who are living here, but certainly someone who makes Aliyah from Birthright or is planning Aliyah, we're here. As well.
I said Birthright, but I meant what's that other organization that actually puts people in? Nefesh B'Nefesh. That's what I meant.
Nefesh B'Nefesh. Yeah, anytime Nefesh B'Nefesh gets a question about healthcare, they send them to us.
Okay.
Why don't you tell us, Ayala, a little bit about
who was Shira Pransky?
Exactly.
Okay, yeah, so I'll tell you who Shira Pransky was. Shira Pransky, Zichronah Livracha, was the wife of the founder of our organization, Gabe Pransky. She passed away, unfortunately, at the age of 26 from lymphoma, and she left behind her husband and a 2.5-year-old son. And when Gabe, our founder, who I still work very closely with and like a lot, when he's a great guy, when Gabe was kind of reflecting on their experience, and she was sick for a very long time and on and off, and it was a very long process. And he basically realized that they had just missed out on so many benefits out of ignorance. They didn't know that they were entitled to coverage, for, transportation to chemo. They didn't know that they could apply for additional benefits from the government. And so he wanted to make sure that other people in his situation didn't just miss out on benefits. So he started this project. And initially it was really started as more just a resource, like having these resources available in English and raising awareness about the rights. And since then, it's expanded into some of our other programs where we offer a little more education, more hands-on personal assistance as well.
Take us through some of the exact things. So you have all of the pages on a website translated. Tell us about that.
Yeah, so the website Kolzchut, I don't know if anyone's familiar with it. It's a pretty large website in Israel that has basically any right or any social benefit that one would be entitled to as an Israeli citizen or resident is listed on that website. And we translated pretty much anything related to healthcare into English. So if you go on their website, anything that's in English is the work of the Shira Pransky Project. We translate, we update the pages, and now on their site, we have about 700 pages of healthcare related rights that are in English, so you could really easily see that and read that. And in addition, we also have our own articles and blog posts and guides on our website that are a little more expansive and not just translated.
And since you mentioned, what's your website address?
www.shirapranskyproject.org.
That's easy. Okay, so in addition to all of the translations of the pages that people can do on their own, you also provide, I'll call it personal assistance, because you can call in and have a healthcare advisor help you.
Yeah, for sure. So someone who, let's say, either doesn't know where to look for a resource, or they've read the resource and something's unclear to them, or they're dealing with something very complex and, you know, feel like they're banging their head against the wall, which I'm sure we've all been there in this country, they can contact us. We have a phone number. You can call us, and we will call you back. You might not answer when you call, though. And you can email us. And if you basically explain what your issue is, and a healthcare advisor will get back to you. And usually there's a basic intake process. We go over, you know, a lot of times people don't even know what their issue is because the medical system can be so complex. They don't even necessarily know why they're stuck. So we kind of pinpoint that for you, help you understand what you're dealing with, how to deal with it, explain to you what your rights are, what your benefits are, and then we'll walk you through how to actually get that benefit.
So you walk them through, wait, Jonathan, one moment. You walk them through the general process, but you don't actually make the phone calls on their behalf to the physicians or hospitals or wherever, right?
So our general goal and philosophy is to try to empower the person to do that themselves and have enough education and skills in what we're doing to do that themselves. There are definitely occasions that we will make phone calls on people's behalf, but it's definitely not like the norm. That wouldn't be what we do for every single person.
Okay, Jonathan, you had a question.
That was Michael. I just want to know, where do you see the next steps in the development of the project? Where would you like to take this?
Where would I like to take
Yeah, good.
Yeah, sorry. Someone else want to?
Go ahead.
Oh, yeah. So the next step of the project is, first of all, I really want to expand those healthcare advisors. We help a lot of people, but people need more help even than we can give currently due to our capacity. So we want to expand those roles. I'd love to have healthcare advisors that are specialized in different healthcare subjects. So for example, if someone comes to us about an issue that's specific to senior citizens, they can speak directly with someone who works with senior citizens, pediatrics, all of that stuff. And I mean, big picture is to be really big and hire people in other languages, Russian, French, Spanish. But in terms of what I would say the next step is to expand our existing programs to be able to help more people in a broader way.
How many staff are you?
Right now we're 3 people. It's me, our healthcare advisor, Leora, and our translator, Cheryl. They're both wonderful.
Great.
Yeah.
And your approximate annual budget is about 200,000, 250,000 shekels?
No, closer to 250,000. Yeah, shekels. What was our annual budget for Corona, during Corona, now?
Yeah, exactly. So.
Yeah, we've over the last couple of years fluctuated between like an $100,000 and $200,000 budget. Right now we're on the lower end of that, but we're hoping to get back up to that 200.
So 300 to 500,000 shekels.
Yeah.
Just again, when I bring people in to speak, I always want the audience to understand that we're not talking about these massive organizations. You sound like a massive organization with translating hundreds of pages and having healthcare advisor to help hundreds. How many people do you help per month approximately?
Usually about 150 a month.
150 people a month. Okay, so that's every day a few people calling and walking them through and doing the research for them if you don't know the answer, etc. And
Yeah.
it's just really the two of you with the translator.
Yeah,
So.
that is what it is. Yes.
Right.
Plus our workshop.
Okay.
Do you
So-
work
Yeah,
at all with
yeah.
the HMOs, with the Mujeres or Clalit or any of the?
So we
Which is
have
what?
relationships with people in most of the Kupot. We don't have any official, like we don't represent them. They don't represent us, but we definitely have relationships with people in the Kupot, particularly Mujeres and Maccabi.
Yonatan, you had a question?
How do you make your budget, Ayala?
How do I make my budget? I work really hard at fundraising. I ask people for money. I write grants. That's how we make our budget for the most part.
And you have a marathon fundraiser?
Yeah, we have a marathon
the Jerusalem
fundraiser, which is
Marathon.
hopefully happening October 29th this year after not so short hiatus. But typically we run with a team in the Jerusalem Marathon, and that's our like grassroots fundraiser. And then beyond that, it's private donors, foundations, things like that.
Right. Okay. And then the third thing, so we have all of the translation pages, and then we have the healthcare advisors giving advice, and then you have a third thing where you actually go out into the community and do workshops. So tell us about that a little bit.
Yeah, so we have workshops. I currently give all of them. We run about 15 workshops a year, where we go into different communities, different communities with a heavy Anglo population. Sometimes we'll actually reach a community in Chutz La'aretz before they make Aliyah so that they're prepared. And I basically give an overview either on healthcare in general in Israel or on a specialized subject on healthcare in Israel, so that people are educated both in the general terms, have basic knowledge that if they do end up in a situation where they need something, they at least have the basic language and knowledge. They know what questions to ask. That's the biggest thing. Like I said, sometimes people don't even know why they're stuck. And even if you just know what question to ask, that's a big help. Our most popular workshop is called Israeli Healthcare 101, where we go down to the basics, understanding, your Kupat Chalim, your HMOs, supplemental insurance, what to do in an emergency, all those types of things. And then we have specialized workshops for specific communities that want it. So we'll have one on mental health care in Israel. We'll have on, fertility treatments in Israel, things like that. And we have all those workshops available.
Yeah, one thing you didn't mention that Yonatan asked about funding, and you mentioned how you get your funding, but you did not mention all your services are free to the public.
That is true.
Right?
They're all
There's
free.
no charge for.
There's currently no charge.
Okay.
Yeah.
Good to know.
Yeah.
Do you ever get, like, I'm curious, questions that are maybe not medical related, not medical specific, but medical related? So for example, one thing comes to mind would be like questions of halakha and medicine, and that.
Oh yeah, we don't actually get a lot of those, although I have been in touch with Sohar recently, because Sohar recently started like a hotline for people who are dealing with halachic questions for end of life. And they contact us and said, if we have someone who maybe that might be an issue for them, that they're speaking to you, maybe you can connect us. We don't really get a lot of those types of questions related to halakha and things like that. We get things that I would say are adjacent to medical and healthcare, but not directly healthcare, in the sense of like a lot of Bituach Leumi questions, which Bituach Leumi is related to healthcare. Those are the, like, let's say disability benefits, long-term care benefit, which is definitely related to healthcare because you typically need to have a health issue in order to qualify. But the process of applying and getting it is not necessarily super related to healthcare. And the other questions that we get a lot that are not related to healthcare, but also people kind of associate is a lot of parents, when they're asking us things about their children, they often ask about things within the education system, like looking, if they're looking for a sayat refu'i, like a medical assistant guy. Yeah, so things like that, which in their head is very related to healthcare, because the reason their child would need that is because of a health issue. But I can't really help with the education system.
Right. At least not yet.
Not yet. I mean, my kids kind of know it would beg to differ. They think I have what to say about the education system, but it's not my job. Yeah.
Okay. Is there anything else you want to add that we didn't ask about specifically? And then we'll see if anybody else has any other questions.
Anything else I want to add? I'm trying to think. I feel like you covered a lot of it. You know us pretty well. I
try.
Yeah, I just always add that, first of all, obviously we're a nonprofit and rely on donations. So we appreciate everyone's support. And it's really necessary. And I'll just say that obviously if anyone needs help, that we're here, and it's what we do, and we're happy to help and contribute. And what we do is, I see every day how much of a difference it can make in people's lives, the level of stress that can be reduced, really the amount of money people save just by knowing this information. It really makes a difference, and I'm really proud of what we do.
Great. Okay, does anybody have any questions before I ask Ayala some other one?
I'd like to say something. It's not really a question.
Robin.
Hi. I just want to say, Ayala, that the stuff you do is amazing. And I feel that I've been a beneficiary, because earlier this year, my health fund closed a major branch that was like very highly Anglo, and they kind of abandoned us. And it was really nice that you got out there and advocated to make sure that there would be a place for us to go to, and kept the information available about who's going to be there, what doctors are going to be there, where we can go. And that was a real big help.
Well, I'm so glad we were able to help you. Thank you for saying that. Yeah, we were really with you on that one. That was not a fun situation. But I'm happy hopefully it was mostly resolved.
Yes, from all the posts on Facebook, I see that it looks like there aren't any, but no one's left asking questions, so it looks like it was resolved.
Yeah, exactly.
That's the way I judge it. So,
okay, great.
And you have three. Yeah, tell us about your children.
My children. I have 3 children.
Yes.
They're really cute. I like them a lot. I have twins who are going to be 5 in January. Twin boys, and I have another boy who's going to be 2 in December.
Do they understand yet which one is older?
Yes, it's not good.
How did you survive COVID up until now with 3 kids at that age?
And your husband works full time, and so do you.
Yeah,
I have no kids at home, and we barely survived.
Yeah. So iPads are great. How did we survive? Well, I think it must have been the second Seger, third Seger, who knows anymore. Whatever Seger it was, we basically worked in shifts. My husband wouldn't start work until 10 o'clock. I would work from 7 a.m. to 10. Then I would take over the childcare. He would start work at 10. Then I would be with them from 10 to 12. Then at 12, my youngest would nap, and I'd put the other kids in front of the TV and work from 12 to 2:30. And then after bedtime, you just work for another 2-3 hours and hope that it ends soon, because how long can you do that for?
Good Lord.
Yeah.
Kol hakavod.
Thank you. It was fun times. Yeah. Parents of young children no one's had it easy, but it hasn't been fun. Basically, it's not something I ever intentionally told them that one was older than the other. It was kind of just something that they became, because I don't think I ever mentioned to them specifically, but obviously people know, and it's something that has come up. And when I say older, I mean that he's 45 seconds older. The minute had changed on the clock, so their birth certificate has 2 different times on it, but there's no way it was more than 45 seconds. And he just walks around I'm the Bechor, I'm the older brother.
The older brother.
And I'm hey, listen, you're bragging about being the Bechor. But on Erev Pesach, when your brother's sleeping in and you're waking up at 6 a.m. for a siyum, I don't know who's going to be walking around going, I'm the Bechor, I'm the Bechor. So we'll just wait for that to catch up with him.
And as they learn a little bit more about the stories in the Tanakh.
Yeah. Yeah. I'm like, listen, I'm an oldest child too. It's not all that it's chalked up to be. So yeah, they know who's older, but they're great. And then my now toddler is very cute and sweet. And
by the way, I didn't used to be an oldest child, but apparently both my older sisters have reduced their age, and I'm now the oldest.
Oh, that's good to know. I guess that's one way to do it also.
Yes.
Yeah.
Okay. Terrific. Anybody else have any questions about Ayala, about the Shira Pransky Project, healthcare in Israel? While you're here she is.
Right.
Right, my elbow hurts. Like, can you tell me?
Yeah.
Is there an elbowologist?
I do have one more question. Have you reached out to Anglo healthcare providers in various fields, such as social work, such as pediatrics, et cetera, to kind of get them on board with the project and also help promote the project within their own professional daily lives?
Yeah, so it's something that we've talked about a lot. In terms of the social workers, we've definitely reached out to a lot of social workers. There are a lot who know about us and who recommend us. And we've had a few meetings with various Anglo social workers in a couple, of the Kupot. And so we definitely have a relation with them, and they're definitely aware of us, and they'll send people to us if they feel like something's out of their wheelhouse. In terms of doctors specifically, it's something that we've talked about, but it's a little bit complicated because as an organization, I don't want to be liable for anyone's issues with any specific doctor. So we, in general, will refer you to maybe a general list of doctors, or we'll refer you to a crowdsourcing group for doctors, but we're generally pretty hesitant to align.
I was thinking the other way, like a doctor who is dealing with an Anglo patient could refer you as a source to how to navigate the bureaucracy.
Yeah, we definitely have some Anglo doctors who know me and therefore have sent to the project. But I wouldn't say it's something that's widely done.
Okay.
Yeah. Okay, thank you. Anybody else? Last chance. Terrific. So, Shana Tova, Gmar Chatima Tova to everybody.
Thanks for having me.
My pleasure. You should have a meaningful fast for everyone. Yes. And that's it. Thank you very much, Ayala. Have a good evening here.
Thank you for having me.
Thank you so much.
Nice to meet everyone.
Thank you. Shana Tova.
Thank you, Shana Tova. Bye.
Thank you, Daniel. Bye.